The direct-to-consumer obviously is now growing, as I mentioned previously, from about $500 million last year to multi-billion dollars in 2025. I think the patients, the reason that trend is occurring is because I think patients are demanding it. They're bearing more cost of the healthcare now, and so they're asking for a higher expectation in terms of faster access to care, to appointments, not having to wait. And I think there's a part of an overall desire and expectation for real-time, on-demand type of services. And that's true in healthcare, it's also true in everything else. Social media and the digitalization of our lives have really changed the expectation of particularly of our millennial generation. I believe that to ask them to say, why don't you call us back in 60 days for an appointment, that's no longer an expectation. What that's doing though, it's causing disruption into the market space in a very significant way. If you think about the total size of the healthcare market, now you have multi-billion dollars of that market segment that is now doing direct to consumers. The typical traditional hospitals and plans some of them will choose to participate in the direct to consumer, some will not participate, and I believe ultimately that either that becomes part of the model for healthcare or you're not going to survive, because the cost basis has to go lower, and you can't do that without this type of services.